Ever wondered why some women have lumpy or rope-like breasts? It's more common than you think. Welcome to our exploration of the fibrocystic disease of the breast, a condition that affects a high proportion of women, particularly those in their fertile years. Despite its name, fibrocystic breast condition isn't really a disease. Instead, it's a term that medical professionals use to describe a range of changes that can occur within breast tissue. Now, these changes can be a little unnerving, especially if you're not sure what they represent. But rest assured, fibrocystic breast condition is not something to be overly alarmed about. It's a condition that manifests as a change in the look and feel of the breasts, often resulting in a lumpy or rope-like texture. But if it's not a disease, you may be wondering, then what exactly is fibrocystic breast condition? Well, that's a great question. Let's delve deeper into this topic and find out more. In simple terms, fibrocystic breast condition is when the breasts feel lumpy or rope-like, but it's completely benign, meaning it's not cancerous. You may wonder, what causes these peculiar changes in the breast tissue? Well, the answer lies in the fluctuating hormone levels during a woman's menstrual cycle. As these hormone levels rise and fall, they can cause the breast tissue to thicken or swell, leading to that lumpy or rope-like texture. This thickening can also lead to discomfort, swelling, and tenderness, which can be especially pronounced just before the menstrual cycle. Now you might be thinking, doesn't a lump in the breast mean cancer? In many cases, yes, lumps can be a sign of breast cancer. But in the case of fibrocystic breast condition, these lumps are benign. They're not cancerous, and they don't increase your risk of developing breast cancer in the future. It's important to understand that the presence of these lumps and the accompanying discomfort are not indicators of a serious health risk. They are simply a response to the natural ebb and flow of hormones in a woman's body. However, this doesn't mean that fibrocystic breast condition is something to be taken lightly. The discomfort and swelling can be quite distressing for many women, and it's always important to keep an eye on any changes in your body, especially when it comes to your breasts. Regular self-examinations are crucial, as they can help you become familiar with the normal texture and sensitivity of your breasts, making it easier to spot any unusual changes. So, while fibrocystic breast condition is not a disease or a precursor to cancer, it's still something that requires your attention and understanding. The more familiar you are with your body, the better equipped you'll be to notice any changes that could indicate a more serious condition. But how can you tell if you have fibrocystic breast condition? The signs of fibrocystic breast condition are quite noticeable but can vary from woman to woman. This condition typically manifests as a series of symptoms that can range from mild to severe. One of the most common signs is a sensation of lumpiness in the breasts. These lumps or nodules, often described as having a rope-like texture, can be felt beneath the skin. They can move slightly under the fingertips and are usually found in the upper and outer areas of the breast, extending to the underarm. Tenderness and discomfort are also frequent symptoms of fibrocystic breast condition. Women might feel a generalized breast pain or sensitivity, which can sometimes be quite uncomfortable. This tenderness is often more pronounced in the days leading up to the menstrual cycle. Interestingly, the intensity of these symptoms can fluctuate throughout the menstrual cycle. They often peak just before menstruation and subside afterwards. This is due to the hormonal fluctuations that occur during this time. It's important to note that while these symptoms can be indicative of fibrocystic breast condition, they can also be associated with other breast conditions. Therefore, any significant changes in the breasts, such as new lumps or changes in the size or shape of existing lumps, should always be reported to a healthcare provider. Remember, early detection and intervention are key when it comes to managing any health condition. Knowing about fibrocystic breast condition is the first step towards understanding your body better. So, in today's discussion, we've learned quite a bit about fibrocystic breast condition, haven't we? We now understand that it's a common and benign condition, characterized by lumpy or rope-like breast tissue. We've dived into its various symptoms, from tenderness to discomfort, and emphasized the importance of self-examinations and regular checkups. Remember, understanding our bodies is crucial for our overall health. So don't forget to subscribe and hit the bell for more informative videos like this one. Stay healthy, everyone.